Hi, this is Dr. Sharma from Colonel's Dental Spa, Bangalore, India. Tobacco use, in addition to the kind of general health conditions that it might impair, it also has a devastating effect on the gums and inside the mouth. Blood flow to the gums, which is so important to keep the gums healthy, becomes impaired because of smoking. The tobacco or the nicotine contains almost 200 toxins which can cause a lot of diseases inside the mouth. In addition to that, the stains or the tobacco or the nicotine stains on the tooth surface make the tooth surface a little rough where food gets stuck onto the tooth surface. And then once the food is stuck on the tooth surface, bacteria grow upon this food, causing more of gum diseases. And since the blood flow to the gums is reduced, the healing is impaired. So definitely smoking has a very bad effect on the gums and of course the healing. I think smokeless tobacco is a myth. It is actually as damaging as the natural tobacco. Smokeless tobacco also causes stains on the tooth surface, and it also causes the blood flow to the gums reduction, and it can be equally damaging. Even there is a risk of oral cancer. Smokers should look for swollen gums, bleeding gums, persistent foul smell from the mouth, and receding gums. These can be the early signs of gum diseases, and for which I think a person should visit a dentist. Yes, smoking not only increases the likelihood of developing gum diseases, but also makes the disease more severe and harder to treat. The immune system or the repair system in the body gets hampered. The gums become more resistant to treatment. Smoking decreases, as I said earlier, the blood circulation, making it harder for the body to deliver the nutrients needed for healing. This slows down the recovery process. After procedures like scaling or the other procedures of treatment are done. Even for implants, a lot of patients go in for implant treatment for missing teeth. We are an implant center. We do implants every single day. But then smoking is something which we don't encourage, and we make the patient aware that smoking can lead to a loss of the implant and even loss of the tooth per se. Advanced gum disease can be pronounced as periodontitis or deep infection inside the gums. Treatment is actually tailored carefully, as tobacco can cause impaired healing. Most common effective treatment includes, first of all, stop the cause, stop smoking, counseling the patient, remove the cause. If we keep treating the effect and we don't address the cause, the effect will keep coming back. That's what I keep telling my patients. Deep cleaning, scaling, subgingival curettage, removing the plaque and the tartar from below the surface of the gums, periodontal surgery, either flap surgery or bone grafts. There are a lot of treatment options available which are at Colonel's Dental Spa. They are painless treatments which are more predictable, antibiotic coverage, antimicrobial therapy, laser treatment, smoking cessation or stopping support, and counseling. These are some things which all combined together. A small program can be tailored or made for the patient per se. Long-term use of tobacco or smoking can cause xerostomia. Xerostomia, in common terms, is called dry mouth, where the saliva flow decreases. Now, first of all, we should know why is the saliva required inside the mouth? The saliva is required to keep the gums healthy because the mouth contains a strong hundreds and thousands of bacteria and viruses. If the gums become dry, these bacteria and viruses grow upon the gums and cause disease. Saliva, or keeping the gums wet, saliva helps in not letting the gums get infected. Now, smokers can manage dry mouth first of all by stopping smoking, stopping the cause per se. They can also stop a dry mouth by keeping the mouth hydrated by drinking water, sips in between, chewing gum which is sugar-free, using saliva substitutes like biotin or improving the air moisture, reducing caffeine, reducing alcohol, which also contributes to dry mouth. And first and the foremost thing is to quit smoking and maintaining a good oral hygiene. You can even ask your dentist for other remedies.